Vijay Sankhla. Come on up here, Dr. Sankhla. So this was probably about a month ago, and Margaret Payton, she had, there's always a little story here, Dr. Sankhla. So this is the Nurses' Choice Physician of the Year Award. So Margaret Payton had sent an email and then followed up and said, Regina, we think the world is Dr. Sankhla. We have other physicians that have been recipients in the past, but we think it's Dr. Sankhla's year. Is there, although the nurses in IR haven't directly worked with Dr. Sankhla, is it still okay that we recognize? And the way that I and the nurses feel around here about the medical staff is there's never enough opportunity to recognize members of the medical staff. And honestly, these awards today, although it's during Nurses Week and Nurses Day, et cetera, again, not to repeat myself, it's a way to say thank you to members of the medical staff for the collaboration, that collegiality I mentioned before, and quite honestly, helping us take really good care of our patients. So whether it's a rad tech, an ultrasound tech, CAT scan tech, MRI, or a nurse in interventional radiology, you deserve the recognition today. So I just say that ahead of time. Because I'm going to get heat a little bit later when the IR nurses say, oh, Regina, we don't work with Dr. Sankhla. How did we recognize him? And I know that how they feel about Dr. Sankhla.
Dr. Sankhla.
Thank you, Dr. Thank you, Carmela. So I was saying to Jim Clark before, because the comment that I have with Dr. Sankhla, and he's such a, I'm telling you, he's such a gentleman and such a kind soul. And I said to Dr. Clark, there's like anecdotes about all the physicians, and I haven't had the detailed background with Dr. Sankhla. And he goes, oh, you mean the strong and silent guy in radiology? And always willing to get the job done. And what translates when Margaret had submitted this nomination, the connotation I had in my mind was Sankhla is the one who ultimately gets the job done and has that tenacity that we need from that he has from the radiology perspective. So with that, so this nomination comes from Carmela and Margaret and all the staff in imaging. From the team member perspective, it was unanimous from all of our modalities. We love Dr. Sankhla. All the reasons were irrefutable, from his smile, always well dressed, always dressed professionally, being approachable, so down to earth. He really, really cares. He's very kind and patient, excellent bedside manner, and from the student's perspective, he never intimidates or scares us. I guess they asked the students to do the submission also. Always takes the time to compliment and ask, how are you? He's always willing to talk about his beautiful family and how proud he is of all of their accomplishments. From our work-patient flow, he never keeps the technologist waiting, and more importantly, a patient may be in a compromised state from a barium study. From the management perspective, he arrives on time, always where and when needed, has filled in when someone is out sick, willing to make changes to cover a fellow radiologist, and never ever complains. On a personal note, we all know in imaging that Dr. Sankhla hates to be cold. He bought a heater and circulates the department depending on his assignment, and always willing to share if his room assignment is comfortable. It's nice that you're sharing. Dr. Sankhla is kind, caring, and very dedicated to his profession as a radiologist. Our department and OMC. He wants to do the best for the patient, what the referring physician asks, and help to meet the hospital's bottom line and ultimately provide the best service. We in the imaging department respect him as a radiologist and are very glad to have him being recognized as our Physician of the Year. Congratulations, Dr. Sankhla.
Silent guy, but it's going to be great. I would like to wish all the nurses Happy Nurses Week. I also want to thank the radiology nurses, particularly Carmela and June. I have worked with you guys, not the IR nurses, but I've worked with you guys, and you guys are wonderful. And to all the nurses, are wonderful here. Also want to thank radiology staff and administrative staff, particularly Margaret, Carrie, Shireen, and Allison, for nominating me for this award. I've worked at a couple of different places, and this hospital is really a wonderful place to work. My wife is also a lab technologist working over here, and she also agrees with me that this is a much better place than a couple of places we both had. Like usually she follows me wherever I go to work. It's not too many, it's just a couple of places. People are very professional over here, and works as a team. I'm fortunate to work with my wonderful and friendly radiologists, medical staff, and of course the administration. There are not too many places where you can call the administrator, "Hi Dean, how are you doing?"
Great. Thank you. I called, I went over, because Dr. Sankhla is here every day, so I went over to give him the news. I got to, I think, Shireen and Margaret and Allison to say I was trying to get in touch with him, and he said, well, when's the party? So I tell him, are you sure it's the 9th? Because I'm leaving on the 10th. I guess his daughter's in South Africa, and she's studying abroad this semester, so it's great that we were having our party today. The last, or the